What can you do to prevent dementia, Alzheimer's, and memory loss?
Well, there's all kinds of causes of dementia. And let me just talk about two. One cause of dementia is little tiny strokes. And this is a slow progressive dementia. You get a big stroke, you get a whopping loss of brain function. But we're talking about something that is kind of insidious in its onset. Little tiny strokes will do that. And of course, that's due to the Western diet, high fat, high cholesterol, meat-laden, dairy-laden diet. And then the other common cause of dementia, well, let me just mention one other brain disease that's really of great concern, which should be, and that's Parkinson's. Parkinson's is caused by organophosphate poisoning, pesticide poisoning. And, you can do the research on that, or again, you can go to my website and look under Parkinson's under the search engine. Alzheimer's is a different thing. There's a couple of big articles I wrote on Alzheimer's. One that I wrote just recently. Alzheimer's is due to aluminum poisoning. Yeah, it's due to, why do we know it's due to aluminum poisoning? Well, it's because of research that started about 50 years ago. What they started doing is examining people's brains that had Alzheimer's disease. How do you know somebody has Alzheimer's? Well, they have a very classic lesion. You look at slices of their brain and they've got what we call senile plaques and neurofibril tangles. And if you have to see this lesion or you cannot call it Alzheimer's. It's a pathognomonic disease, so that the pathology names the disease. You see these plaques, you've got the disease. Anyway, they started finding out that people had more Alzheimer's who lived in areas of the world where the drinking water was highly contaminated with aluminum. I did mention they ground up the brains and they found out, whether or not they had high levels of aluminum or not. Then the next finding was the epidemiology, where they looked around the world. And the most undeniable causal relationship between aluminum and Alzheimer's came about with the electron microscope. By dissecting the lesion, this pathognomonic senile plaque, neurofibril tangle, by dissecting this, what you found is that these senile plaques had a central core of aluminum silicate, magnesium aluminum silicate. And you cannot have the senile plaque without the central core of aluminum silicate. And unless you have the senile plaque, you can't have Alzheimer's disease. And also, there's some work that shows that chelating agents that drag aluminum out of the body will not only drag the aluminum out of the body, but will slow the progression of Alzheimer's. And again, if you want to know more about this, just go to my search engine and put in Alzheimer's.
You've talked about diabetes. What should you do if you already have type 2 diabetes? Can it be reversed? And what are the exact actions to take to do so?
Type 2 diabetes, by definition, is 100% curable. Okay, you have type 2 diabetes where you have profound insulin resistance. As a result, the body will often make more insulin than the normal person does. Just the insulin doesn't work because you're too fat. That's type 2 diabetes. Then you have type 1, where the pancreas has been destroyed by an autoimmune reaction to milk most of the time, cow's milk. And so you've destroyed the pancreas, and now you have the spectrum here, from a fully active pancreas to a destroyed pancreas. And in between, you have a spectrum of diabetes, and I call this partial pancreatic insufficiency, or type 1.5 diabetes. And in those cases, where you have the partial pancreatic destruction, it's not going to grow back, nor total destruction. Now, most of the people have enough pancreas working that they run a normal blood sugar and their diabetes appears to be completely gone. I think the thing that would convince my colleagues most that this is true is there have been many studies published on bariatric surgery. A couple of them I can think of in the New England Journal of Medicine, where they showed about 80% of people who went through surgery to cause a malfunction of their intestine. 80% of people were cured of their type 2 diabetes. So any weight loss program will cure type 2 diabetes is what I want to come down to. And the most effective, healthiest program that you're interested and likely to keep with is the McDougall Program. We have research that was done at Oregon Health and Science University, a 1-year study done on my patients, and the compliance was 85% of the people follow the program for a year at least. 85% of the you get people to take drugs at that rate. And why did they do it? Why did they follow the program? Well, number one is it's really tasty. The food is really good. You get to eat a lot of food, and people love to eat. And number two, the benefits are so profound. Weight loss, get rid of diabetes. In this case, we were treating multiple sclerosis. So, it works. Type 2 diabetes is curable 100% of the time. Type 1.5 diabetes, sometimes you have to use a little medication with them. Type 1 diabetes, you always have to use medication, insulin. And besides the same diet you use to cure the diabetes is the diet that prevents complications associated with diabetes, like heart disease and impotence and cancer, et cetera. So you're doing a double whammy good thing on yourself by eating a good diet to cure your diabetes. Yeah, you can cure, I told you can cure your diabetes with surgery. You can even eat the Atkins diet and cure your diabetes because of the weight loss. But you can only do it in one healthy way that's good for you and the planet.
What about eggs? Are they healthy? What about egg whites? There's a lot of press about choline and the importance of consuming eggs to get enough of this nutrient. Can vegans get enough choline?
Well, yeah, vegans can get choline from plants, and that's where it originally comes from. As far as eggs go, eggs are for Easter, at most. An egg, think about what an egg is. Egg is an absolute miracle. Packaged within this shell are all the ingredients necessary to grow blood vessels, eyes, tails, beaks, claws. An entire chicken is put inside this little shell. This is a very nutrient-dense organ, okay? And as a result, when you feed these very nutrient-dense, high-nutrient foods to people who are already sick from overnutrition, they get sicker. And egg is, of course, is the highest cholesterol of any food. It's also high in sulfur, and sulfur contributes to cancer and irritable bowel disease and heart disease and all kinds of things. Eggs. As I say, eggs are for Easter. As far as choline goes, there's a whole other story to this choline. It has to do with a substance that's made. Golly, why can't I remember this? Anyway, tau. It's the tau substance. What happens is when you eat choline, the non-vegetarians have a bacteria that turns it into a very toxic substance in the bloodstream. And I think it's TAO. Anyway, the mind sometimes doesn't get all the facts. So, when you eat a high egg, high meat, high choline diet, you encourage heart disease by this particular mechanism. And it's trimethylamine oxidase and whatever. That's what it is, TMAO.